What's up, guys? Welcome to Couple Nerds Podcast with your hosts, Matt Sartrick, and myself, Peter Fundera.
Hola.
Hope everyone having a good day, and thank you for tuning in. Don't forget to follow us on Instagram, check out our YouTube, download our episodes, subscribe.
There you go. Another beautiful Friday. How you doing today, Petey?
Doing good. Nice weather. November 1st, right? Turkey season's coming.
Turkey season. Black Friday shopping.
Are you doing no shit in November?
I don't know. I feel like my beard would get nasty when it comes to work, especially with also flu season. Imagine putting that mask on. I'm going to have all that extra airflow going into my mask that could possibly expose me to RSV or the flu.
All I hear is excuses.
So shave it, grow it out, huh?
Grow it out, dude.
We'll see. I possibly might start it. So on today's episode, we're going to talk about how the body cleanses our blood, how we detoxify. The main two organs we're going to cover are the kidneys and the liver. And we're also going to talk about a story about a mom that the son developed RSV, flu.
Yep, that's correct. I think it's from Ohio. They're
Ohio?
Yeah, I'm not sure. So, all right, with the health news. Start off. So, it's flu season. So, everyone's focused on the flu. You know, flu symptoms, flu shots, all that jazz. But a lot of times people are neglecting this RSV, which is more predominant in the flu season. But it kind of gets looked over just because we're so focused on the flu. So there's one lady named Vanessa Lachey, or Lachey, her name is. I'm pretty sure she's an actor. I'm not sure what kind of movies she plays in or how famous she is. But she has a 1-year-old son. He was born premature. That's not really the issue at hand. But her son started developing like these flu-like cold symptoms. So he had a headache, or not really headache, but he had a fever for a few days that wasn't going away. He was a little bit lethargic. He wasn't acting like himself. He wasn't as active as he usually is. So she brought her into the doctor. Doctor did an examination, listened to breath sounds, and says it should go away. He should be fine. They're planning on going on vacation. Doctor said, it's okay. It'll clear by itself. What happened is they end up going on vacation, and their child gets more lethargic, starts getting more ill. And they were out of the country somewhere. I don't know if it was Bahamas or somewhere. And they were not able to treat him with anything. Wow. So they took a plane ride home, emergent plane ride home, and they ended up taking the kid to hospital. And what comes up is that kid ended up being in the NICU for 6 days for RSV. Wow. So this is there's a simple test that we could do to check for RSV. It's just like a swab, which sometimes we neglect because we don't really think it's that big of a deal. And for the fact that it masks the flu. So it has flu-like symptoms, cold-like symptoms, and it normally goes away on its own. But there's certain situations where it becomes severe, like for this kid. Normally, we would be able to fight off RSV without any kind of issues, but in this situation, it was pretty devastating.
Yeah, and the way we check for RSV in the hospital is we do something called the respiratory panel. And for those that know, it looks very uncomfortable. We basically shove a little metal wire with a little cotton material at the end, and we just go very deep into the sinuses. And we take it out, we send it on the lab, and what happens is that patient is on contact droplet in between that time period, meaning we're taking precautions, ruling out the virus that this person has. And I think RSV is pretty common, even in adults. And the statistic shows here that it's estimated that 57,000 children, 5 and younger, develop this.
Yeah, so it could affect anybody, but the most damage that it does is for kids that are below 5 and for our elderly. That reason being is because the immune system aren't fully developed and aren't as strong. But like I said, normally this goes kind of unnoticed because it goes away on its own. We get it, we fire it off, and we don't get it again.
Yeah, and this respiratory syncytial virus, known as RSV, the thing is it's a virus, and sometimes, like you said, it masks the symptoms, and sometimes we might just say, oh, my child is having the flu, oh, they're just cold symptoms, little fever, but we're neglecting the fact that this could progressively get worse, and we have to be aware of the signs and symptoms, right? And one thing why this disease is so severe is because it causes bronchiolitis, so literally the upper airway is swelling up, and it becomes harder to breathe, and it also could cause pneumonia, which is just an infection of the lungs. It could be either bacterial or virus.
Yeah. So who is at risk? Like I said before, predominantly younger kids, so less than 5. But premature kids are more likely to get it because they're premature infants, so they came out a little bit sooner than they should have. Very young infants, especially 6 months or younger, children younger than 2 years old with chronic lung disease are also a higher risk, And children that are too younger with chronic heart disease are also on higher risk, and people with weakened immune systems in general are higher risk. But the thing is that the symptoms are so common that people misrecognize it as a flu. So some of the common symptoms, early symptoms, you're gonna have the runny nose, fevers, decreased appetite, cough, maybe a little chills. But once your kid starts wheezing, becomes irritable, starts to be like lethargic, then more lethargic than usual, and it kind of increases over time, that's kind of the time where to bring in. Or they become apneic,
Yes.
where they decide, or where they stop breathing every once in a while they're sleeping. Those are kind of the later stages. And it's usually the care that we provide is more supportive care, just making them comfortable, like over-the-counter medication like Tylenol, just to decrease the fevers. But there's instances like this lady had where she brought her son in and ended up needing hospitalization just because it got so severe to that point. And everyone's immune system different. It's not really clear on who's going to get it or not. It's just kind of a day-by-day approach.
And it's hard to just, tell you as a parent, it's hard to be like, okay, let me just take my, daughter or son, whatever, to the emergency department. Like, it's hard to differentiate that because it's so similar. So it's not bad to call your primary, pediatrics doctor or something and ask if, maybe we should, it's flu season, let's do a respiratory panel. I have no idea how exactly they diagnose kids. I'm sure it's similar, but just being proactive and just being aware of how your kid is. It's like, if you're not a nurse and you're like a mom or dad, just be aware of the baseline of your child and start, looking how he's progressing and what's happening, and hopefully your intuition tells you the right decision to make.
Yeah, if your kid's getting worse, there's no reason to wait any longer.
Mm-hmm.
Even if you go and like the doctor said he's fine, he'll get better. And if the doctor says, hey, he should get better, and he's not getting better, that's definitely a good sign to bring him into the hospital. Some of the hospital measures that we could take besides the supportive ones is the kid's mostly going to get an IV just so you get hydrated, just so he has more volume, just so, your kidneys can process, all the fluid, all the toxins going through. You also want to give him humidified oxygen because, no one likes dried oxygen, and it's kind of more support as well. Sometimes they'll get to the point where a kid might need to get, mechanical ventilation, where they might need to get intubated and vented, but that's in rare cases. And also nebulizers and bronchodilators are going to help just because of the bronchiolitis, like you mentioned, that'll expand those bronchioles and kind of help the kid breathe a little bit, maybe even get out those secretions.
Well said.
Yeah.
Same thing for low urine output, right? Like you said, dehydration. If your little baby's having a dry mouth, they're not peeing as frequently or it's not as much. I don't know, maybe you could weigh the diaper or something. Hey, man, this diaper is a little bit light. Those are all signs that, hey, dehydration, and let's be proactive so, things don't take off for this RSV.
Yeah, exactly. All right, so Detox, guys. Quick Google search will get you a bunch of, detox supplements, detox pills, ways to detox, but a lot of people don't know, or, we don't really think about our blood is consistently getting detoxed by our liver. We kind of don't really think about that too much.
We think it's just a supplement thing.
Exactly. Yeah, it's a supplement that's going to detox for you, but our blood is undergoing detox consistently, nonstop. And detox, it affects many organs. It's done by many organs, like the lungs. The fact that you breathe out CO2, you're breathing out the acidity of your body, so that's kind of like a detox as well. And same with your skin. Every time you sweat, water comes out of your pores, pushes out all those toxins. But the main detox organ of your body, is your two of them, your liver and your kidneys. Those are the main ones that literally filter your blood.
And it's kind of also beautiful how the body works when it comes to detoxing. Let's just say you're metabolically acidotic. You have a buildup of toxins in your metabolic body. What happens is your respiratory system tries to combat that and tries to breathe out more toxins, so it increases the respiratory rate to combat the acidity in a metabolic level. I think it's so cool how that works.
Right, and this works intrinsically. It does it on its own because there's receptors that sense that, hey, your pH is too low, so we got to do this. We got to breathe more. Or if it's too high, you got to breathe less.
And that's what we're kind of doing the whole time. Like in the intensive care unit, we're treating the acid-base balances. We're looking at electrolytes all the time. So this is very good for anyone that's wanting to learn about detoxification, not only in the hospital setting.
Yep. Yeah. So your liver is actually located in the upper right quadrant, right up into the diaphragm and above your stomach. It's the biggest organ in your body. And what's kind of cool about the liver is it's the only visceral organ that can regenerate. So that's why you give liver donations, or they can remove a large portion of your liver with cancer, and it still grows back. All you need is like about 25% of your liver to make it regenerate.
Wow.
To back to its original size, or maybe a little bit smaller. That's actually really cool. I had no idea about this.
I wonder how far scientists are with understanding the liver and how it regenerates and are able to produce organs that can do that in the lab.
Yeah, I'm not sure. I'm guessing that I doubt the liver has any stem cells. I'm pretty sure it has. I don't think it has stem cells. It for sure has. I'm trying to think.
You're like, I'm going to tackle this question, but I really don't know how to say it.
I feel like the liver has its own, you say liver programmed stem cells, where they can't turn into other cells besides liver cells. I'm sure that's probably how it works.
Yeah.
But no other organ can regenerate. Like kidneys, you could live off one kidney, but if you have a laceration of every kidney, that portion is not going to grow back. Liver's pretty cool.
I'm just thinking about it. Wow. It's definitely an awesome organ. One thing that the liver does, it creates bile. And what bile does, it breaks down fats, cholesterol, and some vitamins. And despite all the information that cholesterol is bad, it's actually like very important for us because it is in charge of our hormones, our sex hormones, our like steroidal hormones. It regulates the immune system. So we as a society, we're always like, oh my God, like fat free, let me lose some weight. Like your body needs this. And it's very important because bile is a huge, we neglect it. Like we don't say like, oh wow, like this cell is important or wow, this organ does a lot for me. But bile does quite a bit. Yeah,
it has actually two main functions for the most part. It helps with digestion, absorption. That's one of them. But the other thing is that it helps get rid of bilirubin. Bilirubin is a toxin that's produced as like a byproduct of protein synthesis. So when your body makes proteins, it releases bilirubin.
Yeah. And
too much of that, can make you acidic, can cause damage to your body in general. So not bilirubin, but bile helps to get that bilirubin out of your body.
And that's that jaundice look for babies even when they start off, and those cirrhosis patients when bilirubin is elevated and they have that jaundice yellow look.
Yeah, exactly. Like Matt said, it helps with fat, carb, protein breakdown and creation, but also stores vitamins and minerals. All your fat soluble vitamins, they're stored in your liver. That's your vitamin A, vitamin D, vitamin E, vitamin K, and B12. And supposedly it keeps so much of these vitamins in there, or if you were to get depleted severely, it keeps about a year's worth. Is what?
No way. A whole year?
Yeah.
That'd be insane.
Mm-hmm.
But yet we're vitamin deficient.
Yeah. Yeah. Well, a lot of times that we're deficient of usually the vitamins, like the ones that we can't really get through diet as much. So a lot of times vitamin D we're deficient in. That's from sunlight. It's produced by sunlight, but it's synthesized in the liver.
Mm-hmm.
But you could go months without food and you could still be decently healthy if you think about it. It's partially due to the liver storing all those.
And some people
vitamins.
eat the same diet the whole entire time, so they're deficient in those things. Yeah. Another one, what happens is the liver actually stores glucose. It maintains glycogen levels, and they get released whenever your body needs them. And according to this study here, not even study, this article, it stores about 1.6 kilos, which is 100 to 120 grams of glycogen. Mm. And one of those things that people don't realize is when it comes to even diet, like if you constantly keep eating carbs and your glycogen storage is full in the liver, it's just going to spill over to fat. So that's why like carb cycling is a good thing. Sorry to get off topic here, but when you're carb cycling, you're depleting your glycogen storages, and then if you carb up, you're just refeeding yourself, but you're not like over storing the carbs to glucose. You just get fat.
Yeah. I know I touched on about bilirubin. I actually got that flip with urea. So bilirubin isn't produced after protein synthesis. Urea actually is.
Urea.
Bilirubin is basically your end result from old red blood cells. So when old red blood cells get broken down or get damaged, bilirubin builds up due to all the substances that come out of them.
Okay.
Urea is the one that was the one that is a protein. Is a byproduct of protein synthesis.
Protein and also ammonia, which gets converted. Great catch there. Liver also regulates blood clotting factors. As we know, when people have like the end-stage liver disease, they have that stomach that's full that we tap because they don't have enough clotting factors. And sometimes we give them, platelets and things like that. And the liver, believe it or not, plays a huge immune function role. We have those Kupffer cells that are literally giant macrophages, so they're part of like the immune system. And what happens is when the liver is constantly filtering blood, like these macrophages are like catching on to anything that's bad, from small particles to removing protein to just filtering out like bad cells. I'm not going to get into how it does that, but it's awesome. It's in the show notes if you guys want to get a read more in depth, because we're not going to bore you with giant medical words here.
Yeah.
And also what it does, it has like this surveillance mechanism too, where on top of filtering, it also looks at all those gut toxins that get released, and it filters that out as well.
Yeah, so copper cells are really important, when they're stored in the liver and they're made there. So liver has a giant detoxification effect. So even though they, find toxins, destroy them, filter them through, what they also do is they filter unused hormones or hormones that have already been used up. So your extra testosterone that you already use that you don't need, extra neurotransmitters that have already been used that you don't need, those all get taken out by the liver as well, which people kind of fail to notice. Like we say, okay, yeah, our testosterone is this, but what happens when you have extra testosterone? Where does that go? It obviously gets turned off and goes somewhere, and that goes to the liver.
Even like neurotransmitters, you don't think about that the brain is like dumping out old things, and like the liver is literally a giant recycling plant.
Yeah.
And even like a lot of us, I don't know if you guys follow us that religiously, but we intermittent fast. And in fact, fasting is another beneficial thing that helps with detoxification, because we enter a phase called autophagy, where your body's able to not focus on digestion and focuses on cleaning up cellular debris. And it's just like, it's like housekeeping. It's like just cleaning up house, because no one's coming in and out. It has that digestive break. And that's why having these little periods of stop eating is beneficial for us.
Right, yeah, because when we eat, the antibiotics that they put in our food, all those pesticides, all those preservatives, they get filtered out through the liver. So now with you fasting, you don't have any kind of food or any kind of other toxins to filter through. So your body is literally filtering its own blood. So it's able to clean up your blood, you could say, more accurately, just because it doesn't have any extra stuff to clean. I'm saying that makes sense.
That makes sense.
Yeah.
And the way the liver does this, back to the detoxification part, there's two phases that we're going to cover. Phase 1 is basically taking this fat soluble substance, meaning everything that we just talked about, the debris, the hormones, whatever, and the liver has to use a mechanism in phase 1 to make it water soluble.
It's actually phase 2.
Phase 2?
Yeah. So phase 1 is basically this toxic recognition. And so it uses oxidation and hydrolysis. So it oxidizes things and also uses water to weaken the toxic. So phase 1 is usually recognition and kind of breaking down the toxin into, you could say, smaller toxins.
Okay.
But also phase 1 also uses urea, just because it also builds
chemical reactions.
Yeah, so all the stuff, the chemical reactions, the leftovers from the chemical reactions that are dangerous to you for a long time, they get put to the liver as well. And this is where the medication is usually metabolized, you could say. So like codeine, lidocaine, metoprolol, caffeine, alcohol, acetaminophen, they'll get broken down in this level 1.
Okay.
Or this phase 1, you could say. So this is basically more like recognition and just breaking down this toxic. But the thing with this level, why it's so important to have a healthy liver, is because when you break down toxins, it also exposes you to more toxins, because the pathway of this toxic breakdown leads to a release of toxic through the toxic breakdown. So that's why phase 2 is really important as well, because it takes those toxins plus other toxins and makes them water soluble so they could be excreted. Yeah. So phase 2 is where it actually takes the toxins itself and makes them water soluble, so you could basically go to kidneys and then pee them out, or go to, through the bile duct and come out through your intestines and your colon through stool.
Yeah, and those that don't understand that, let's like look at oatmeal, for example. The reason why oatmeal is so healthy for us and why it's good for the gut is because it has insoluble fiber, meaning it doesn't mix, it's not broken down, and it's not absorbed in the bloodstream. So this fiber from oatmeal is literally hanging around in the gut, and it's just like attaching to crap that's not necessarily there, and we just poop it out. So that's why we say, hey, eat fiber to have a good poop. And what the liver does is it's able to digest it, where the fiber, whatever, is able to attach in the intestines, and you could actually get rid of it.
Right, exactly. And then also in this phase 1, we hear a lot of times about free radicals that cause cancer. Part of oxidation is to cause these metabolic pathways to break down certain things, but then they end up releasing and oxidizing and releasing free radicals. And certain toxins release more free radicals. And the goal is to have a healthy phase 2 so you can get rid of those free radicals as well. So that's why liver health is very important, because when you break down certain things and cause free radicals, that gives you an increased chance of cancer.
Yeah, and those that don't know what a free radical is, basically all these chemical processes is happening in our body, and what happens is a free radical gets produced from what Peter is saying in phase 1, and it's basically missing an electron. And the electron needs another electron to be satisfied in a way. And it'll kind of bounce around, and it could damage and hurt other cells, which could disrupt their function. And eventually, if you have a buildup of so many free radicals, you're like disrupting a specific message, a specific task that your body's doing, and you're able to hurt yourself in a way. Just like cancer, just a buildup of free radicals, and it's manipulating and changing DNA, and you're producing bad. And yeah,
that's true. It's true. So phase 1 and phase 2. Phase 2 is we have it on the show notes. It looks kind of complicated, but for the most part, phase 2 is just turning your toxins into water soluble, so you can pee them out basically. There's like different pathways that they could go through. There's like a glutathione pathway, a sulfate pathway, a glycine pathway, and glucocuronide conjugation. So basically, this is your liver's way of recognizing what kind of toxin it is and how to break it down to make it water soluble. That's all basically those pathways are doing, because amino acids have a different DNA makeup, so do lipids, so does everything else, and this kind of tells your body on how to break it down if it's one of these 4 things.
Okay. Yeah. So we covered phase 1 pretty well. It basically creates oxidation, and there's different chemical reactions that are happening. There's enzymes and liver cells that are very important for this. Specifically, it's called hepatocytes, and they release these chemical reactions, and they have different protective measures for protecting your body and liver from these toxic chemicals. And we talked about free radicals. Also, how to combat that is having antioxidants, of course. I feel like we don't focus on, or there's a doctor that said antioxidants aren't important for aging, that one guy.
Yeah.
But in this case, they are important because we need vitamin C and E to reduce the damage that these free radicals are causing, and they neutralize them in a way. I'm not too sure about the process, but it's basically satisfies that free radical so it could be normal again and not missing that electron to attack other cells.
Right. Yeah. So, I mean, for liver filtration and detox, it's a simple way to recognize this is just your fat soluble toxin goes in, you get your phase 1, which weakens the toxin. Then it goes to phase 2, which makes the toxin water soluble, and it gets excreted as bile, or goes to the kidneys and gets excreted as urine. That's basically a simple gist of it.
Okay.
Yeah. And there's certain mechanisms that, like we said, help remove unused hormones or hormones that were used. But for the most part, your body just, liver just makes it toxic less toxic, makes water soluble, and then excretes it. That's a simple gist of it.
We sound like a bunch of repetitive parrots almost at one point. But this is one of those topics that if you guys really grasp it, you're able to really understand the body and everything else. Yeah,
it's hard to say because there's so much medical jargon in this, and with different receptors, different toxins go down a different pathway, but it still has the same function. It's just different in multiple ways that your body can break down certain things that leads to the same result.
And now when you're on a date now, you could be like, hey, do you know what a Kupffer cell is? Well, believe it or not, man, it's one of the most important liver cells.
Yeah.
Do you want to touch up on the kidneys now?
Yeah. It's the kidneys. Kidneys aren't so much known as a detox as the liver, but it does contribute some detox effects, you could say. But the main function of the kidney, majority you're going to hear, is that it regulates electrolytes, fluid balance, and minerals in your body, which makes sense. It regulates the body's pH. Obviously, if you're regulating the fluid status, the minerals and vitamins, you're going to regulate the pH. Also filters blood. That's probably the main thing we're going to touch upon here, because we're not talking about the kidney in general. We're talking about the detoxification of kidneys, right? So we're not going to touch on any kind of hormone secretion or pH regulation or electrolyte balances.
No.
Not for this episode.
And it's crazy that the kidneys are so important, because sometimes you have those critical patients that the kidneys shut down from just hypotension or the buildup of toxins, and we literally have to get these patients on dialysis, or the CRT as we call them, like a slower way of dialysis. And it's crazy to see how dialysis like reverses the patient literally. Not in somebody that needs it chronically, but somebody that needs it like 1 or 2 times. It has tremendous effects. And that's like kind of like that refresher that gives me gratitude of how important the kidneys are.
Right. It's so important that you have 2 of them.
Yeah.
You can function with 1, but you're created with 2 just as a backup because they're so important for you.
Mm-hmm. And every single kidney has millions of cells called nephrons. These nephrons are straining the blood cells from toxins, large molecules, different fluids, and anything that doesn't have to be there.
So when I used to think of kidneys before I started nursing or anything in the medical field, I used to think of kidneys as like a giant sponge that like things go through it and that's really it. But like Matt said, it has millions of tiny nephrons that filter blood consistently, not just one giant machine. But a nephron actually has 2 parts. One's called the glomerulus, which is when you hear GFR, your glomerular filtration rate. This is kind of shows you the strength of this. And in the glomerulus, sorry, my accent's kicking and I can't really pronounce the word.
Maybe it's that beer you're drinking.
Maybe. It's like a strainer, so it strains for large molecules and toxins, and fluid just kind of goes through. And then once it passes through there, it goes through a tubule, which is another part of the nephron. And in there, smaller molecules like minerals and vitamins get put back in the bloodstream that don't need to come out. So it's kind of like everything that goes through your kidney doesn't get pushed out. The kidney recognizes, hey, this is blood, let's put it back. Hey, this is vitamin B, let's put it back. And then usually it's tied with fluid balance. It doesn't have giant detoxification effects specifically to like bacterial or viral. It's more there for like electrolytes, stability, and toxins that are produced by the liver, you would say. So the liver does the most of the work. The kidney kind of just does the backup. It's usually linked to like urea, mentioned before.
And like these glomerulus, there's different, like imagine like it's like a fishing net and it has different sizes. So the big things that are like proteins or whatever like that, like they don't get sucked into it. Like the important things are small and they get filtered right past back into the blood, but the big things that aren't meant to be there that are needed for detoxification, they get trapped and excreted properly.
Exactly. Yeah, so kidneys are go ahead.
I said another cool little fun fact that's awesome is like the way like the waste product gets dumped into the bladder, and the bladder is nice and relaxed, and it's crazy how all of a sudden your brain signals the muscle to contract to, hey, go use the washroom, you're getting full down there,
It's actually really cool. Yeah, it's like it's relaxed, and then your brain constricts it for you when you gotta pee. It's pretty cool. But I guess for the most part, detoxification wise for kidneys, the most important thing is just urea. Urea is the byproduct of protein synthesis, not bilirubin. I got that mixed up. So urea is protein synthesis. That's a toxin that's released by you creating proteins and your body metabolizing proteins and building it back up. Which protein synthesis is very important for us. We need it to survive. But like with many other things, it has byproducts. And one of those is urea. And urea gets filtered through the kidneys and it gets excreted through urine.
And and if you have that issue, you're gonna get gout, which the urea literally deposits in between joints and it creates these it creates pain.
Yeah.
And also there's specific foods that trigger an increase in urea, so you want to watch out for that if you feel like your doctor tells you your kidneys aren't properly functioning.
Yeah, like high ammonia foods, a lot of processed foods, a lot of fast food, they're high in ammonia, and those are the ones that are kind of the most kidney damage. And guess what? It also comes with high sodium, and that makes your kidneys work even harder.
And if you look at all the processed foods like sodium nitrates and bacon and all this little stuff, like our body, instead of working on fine-tuning itself, it's constantly working on freaking clearing out the shit that we're putting into it, like pesticides and all this stuff. So like that's why fasting is so awesome. Jeez, man, I'm happy I do it because you're constantly dumping crap into it. It's constantly getting cleaned, but you're never taking a break to clean the stuff that's like wrong inside. You're just filtering the external things that are coming in. Right,
exactly. It's like, if you're doing dishes in the sink, all those nasty stuff go through the sink hole, and it goes through there smoothly, but once you start packing on more food, more leftovers from you washing dishes, it starts to slow down. And then you taking a fast is like you taking out the little drain thing and dumping it out in the garbage and doing it all over again. So it gives your body a break from this high filtration that it usually does, this high detoxification, to just naturally detoxing whatever blood you have left and whatever toxins are there. You're better to identify those toxins that got bypassed before.
Yeah, that's a good metaphor. And like we also have to look at an area of focus, which is nutrition. Like, we have to give our bodies the proper nutrients in order to detoxify. And when you look at, for example, like phase 1, you need folic acid, you need B12, vitamin A, C, D, E, and different things. Like, we have to be putting in the right stuff into our body. And like phase 2, we need all these, like, is it glycine or L-carnitine? Like, there's all these amino acids we need on top of cruciferous vegetables that have sulfur. And if we're eating a shitty diet, like, how are you expecting your body to do its job?
Yeah.
Give me the right tools, Mr. Human.
Right. Like, our liver is a giant organ, and people tell us all the time, hey, you need to have your vitamin A between this and this, vitamin B between this and this. But why? You know what it's for? You just know it's for good health. Majority of these vitamins are getting used up by the liver for it to filter and detox your body healthy. It's for a healthy liver. And it's kind of, we never really think about, like, I haven't really thought about, why do I need vitamin A? Why is vitamin A so important? I don't know why it's important. I just know I have to consume it, otherwise my body can't function properly.
Yeah, usually you just hear like vitamin E. Oh, it's good for your eyes. Make sure you eat your carrots. Like, that's the stereotype you hear, but you don't hear the in-depth stuff like you mentioned.
Exactly. Yeah, and on our show notes we have like a little graphic for you guys that tells you all the vitamins that go into phase 1 and all the vitamins that go into phase 2 to function properly. And imagine if you're deficient on like a handful of these, your liver's not going to be able to function properly, or it's going to miss some steps, and you get liver failure, might damage your kidneys, all that jazz. You might not filter medication properly.
And I wonder if you could share some things for nurses when it comes to these organs. One of them, for example, the kidneys are so important, and they're very gentle. If you over make them work too hard, I'm trying to word this properly, like, you could damage them. You know how, like, if your creatinine is elevated and you're not supposed to do the contrast dyes, you're gonna mess up your kidneys where they won't be able to get rid of this toxin. And sometimes when the patient comes in to the hospital with a little acute kidney injury, they sometimes consult pharmacy to titrate the medications to help with the kidney. I'm blanking out on the word here, but they dose it properly to preserve the kidney. Right.
Yeah, because if your kidney is weaker, it takes them longer to filter this medication through, so you're not gonna need as much of it. So that's really gonna ease up on it. And a lot of these medications are nephrotoxic, like antibiotics. And if your kidney's already damaged, you don't want to give them the same amount of vancomycin or whatever that a person with healthy kidneys would have. Or we could always put them on a little bit of fluid, like 100 an hour or 50 an hour, just because it's a lot easier to filter less concentrated blood. It kind of, the liquid kind of helps, push everything through. You could say. I'm not sure how to word it. It's easier to, like, if you have muddy water and you put it through like a strainer,
slower.
If it's thick, it might have same amount of grime, but if it's thick, it's gonna go through slower compared to if you have the same amount of dirt but more water, it'll kind of go through smoother, right?
Yeah, that makes complete sense. Just like portal hypertension, what is that? A backup of blood in the portal system. And then how do alcoholics get esophageal varices? It's just built up pressure from the liver that stores here, and then your varices can pop, and you got to get banned.
Yeah. So when they band, I'm not sure if you know what the banding is, but they actually take
rubber band.
Well, I was thinking about stenting. My bad. I was thinking about stenting the liver, where they take so all the veins and arteries that go, because for liver you have both veins and arteries go to it, because arteries to give it blood and also veins to give it nutrition. I believe that's how it works. And if you have portal hypertension and you need stents, they place a stent from the vein or artery that inflows blood to the liver, and they stent that and put it to the vessel that outflows the blood. So basically you're taking toxic blood and bypassing into liver and putting it back to the system. Why it's beneficial is because your liver is bad and it can't filter things efficiently, and these toxins are going to get through anyway. So you're betting that if I take some blood and put that same toxic blood back into the system, it won't back up as much, and maybe your blood or maybe your liver will be able to do it more efficiently, because there's so much blood backed up, where instead of that blood keep backing up, you're actually just releasing it back to the system. So it decreases the backup of blood, so that'll kind of perfuse the liver more, and it'll still be able to clean it up, but more slowly, but at least you're not getting that backup anymore.
Cool. I just
So
learned
even
that
though
today.
so even though your blood is still toxic and you're sending it to your organs, it's still better off doing that than having to keep pulling back, and then hopefully you're banking on that. Your liver is still efficient enough to keep removing those toxins, just slower.
Is that an ERCP that they do that through?
I don't think so. I don't know actually.
That's interesting because IR could do a lot of these things. One time I had a patient that had he needed a giant. It's almost like the Wills procedure. He needed He got his spleen removed, part of his pancreas. He had an ulcer in his stomach in the fundus area, and he was losing a lot of blood. Like we were giving him like 5 to 6 units a day. He was just losing blood, and IR was supposed to intervene and embolize the arteries that are in charge of like the leaky blood. But I got on the phone with him. I'm like, hey, like, why don't you guys want to do this? Why are you guys waiting for OR to do this? Well, he's like, basically I could go in there, I could cauterize all these vessels, but if he's not going to get blood flow, what is the surgeon going to work with when he has a bunch of necrotic tissue to work with? He's not going to be able to suture back up. So it's interesting how all that works.
It makes sense. Yeah, GI is pretty cool, or like that system. If you think about it, I just haven't worked with it too much. It'll be cool working at like more of like a acute, like very acute level 1 trauma center, but dealing with like these kind of things instead of cardiac. Because I don't know, I never see any of this stuff.
See, that's because you work at a very specialty unit. It's cool. You're good at your specialty, but you're also missing the other things that people do and the procedures and things like that. Should wrap this one up.
Yeah, let's do it. It's gonna warm in here. Take my shirt off.
There you go. After party. Joking. All right, guys. We'll see you guys next week. Hope you guys have a great, awesome rest of your weekday. If you guys have any topic ideas for us, something you guys want to see, shoot us a DM, shoot us an email, and see you guys on maybe that Facebook group.
Yep. And don't forget, Matt's starting travel nursing, so it should be a few days out. November 1st. So when do you start travel nursing? What day is it?
November 13th.
November 13th.
First day in the hospital.
Oh, yeah. So keep an eye on that. Check out Instagram. Was it Matt's Mindset? At Matt's Mindset. Yeah.
That come in the future.
His hair is still growing. We'll see if it does no shit in November. We'll see. Have a good one, guys.
Take care.